We're a supports planning agency, so we're providing assistance to people under the Community First Choice and Community Options waivers. Community First Choice started as, I guess they used to call it the Medicaid waiver, and it was where Medicaid gave states the option of providing services in the community rather than in the nursing home. So if you were next door in the nursing home and you felt like, you know, I think I can make it back in my apartment if I had enough services, and you were an MA resident and it seemed like you could do it, you know, that there was enough hours that you could get personal care services and stay at home rather than pay $73,000 for the typical cost of care in a nursing home, that the state could pay $30,000 for your care in your apartment and save $43,000. Community First Choice and Community Options waivers did some of that, where you had people come out of nursing homes. They could go into assisted living, which was cheaper, or they could try going back into their home or into their apartments. They'd get, you know, significant numbers of hours of personal care services. They could get Meals on Wheels. They could get emergency response systems, home modifications if they needed them, those kinds of things. Well, senior care is for people over the age of 65, and they have to score between either moderate to severe on the disability scale for AIRS assessments. So the health department nurse or the social worker go out, they do an evaluation. You know, if the person scores, you know, in that range, then they have to meet income eligibility, which isn't as dramatic as medical assistance. So you could get, you know, you could be getting $2,500 a month in Social Security and still qualify for senior care. And you're assigned a case manager. They do a plan of service. They sit down with you and see what your real needs are. Do you think you need chore service? Do you need somebody to get you to a doctor's appointment? Is it emergency response system? Do you need depends? You know, what are your real needs? Then you have the people that you're serving through Meals on Wheels, the people that are coming into the centers, the people that you're serving through informational programs. But those folks in senior care and waiver services, those are the most frail, the folks who are most at risk of going into a nursing home. If you looked at the funding for Older Americans Act programs even 15 years ago, or maybe 10 years ago, if you include inflation into the cost of providing those programs, I mean, it's dropped dramatically. So even though for a number of years some of these programs get level funding, each year you're able to do less just because of the cost of programs and services. You know, fortunately the counties have come up with monies to help us. Like in Caroline County, we had a waiting list for home delivered meals. The county said, yeah, we can help fund that. But you know, there isn't a lot of other resources really outside of fundraising, and you know, you're in competition with everybody else that has a nonprofit. And for a lot of our services, people think, well, you know, the government's giving you money, so you don't need any. You know, it should be funded by the state and the feds, and that isn't the reality.